Welcome to Language Access Matters, the podcast that dives deep into the crucial role of language access in public services and businesses. I am your host, Carol Velandia, and I invite you to join me on a journey of discovery and empowerment. Language access is not just a matter of convenience. It is a fundamental human right and the key that unlocks doors to essential services and opportunities. In this podcast, we'll explore the far reaching impact of language access, examining how it shapes not only healthcare, justice, and education, but also the world of business. Through thought provoking interviews, insightful discussions, and compelling stories, we will unveil the power of language access. We will hear from professionals who bridge communication gaps to provide quality care for diverse communities. We will explore the intersection of language, law, and justice, and the crucial role that interpreters and translators play in ensuring fair and equitable treatment. We will delve into the challenges and innovations as well as how language access opens doors to effective communication and inclusion and how it makes our society more equitable. But our exploration doesn't stop there. We will also uncover the profound impact of language access in the world of business. We will hear from entrepreneurs, industry leaders, and experts who understand the value of inclusive and effective communication and how it drives success in today's global marketplace. Language Access Matters is your platform to understand the significance of language access in these vital sectors of society. We will shed light on the barriers faced by individuals and communities and the innovative solutions that promote inclusion and equality. Whether you are a healthcare professional, a legal expert, an educator, a business owner, a linguist, an advocate, or simply passionate about the power of language, this podcast is for you. Together, we will navigate the challenges, celebrate the victories, and advocate for a world where language access truly matters. So, join me on this enlightening journey as we uncover the impact of language access in healthcare, justice, education, and businesses. Let's amplify the voices of the 25 million people that don't speak English in the United States and those that don't speak the dominant language around the world. Those voices deserve to be heard and empowered, and we need to empower ourselves to build a more inclusive future. Welcome to Language Access Matters. Let's embark on this transformative exploration together. Good afternoon, everybody. I am delighted to have Ms. Alissa Creamer today. She is the Senior Director of Education and Community Services for the Immune Deficiency Foundation, or IDF. She guides the foundation's core mission work related to patient, caregiver, and provider education, community support services, and outreach. Alissa has a background in child and family studies and previously worked as a certified child life specialist, providing psychological support and diagnosis and procedural education to hospitalized children and their families. Alissa received her bachelor's degree in child and family studies from Ohio University, a master's degree in public health from George Washington University, and a leadership certificate from Yale University School of Management. She joined the IDF team in 2018 and lives in Maryland. Welcome, Alissa.
Thank you so much, Carol. I am thrilled to be here today.
And we're happy to have you. I think I shared with you that 4 years ago, your organization came to us, and so we consider you one of our founding clients because I realized how devoted your organization was with cultural competence and language access. And in fact, I think you translated, or your organization ordered like 5 different language translation, and we were, of course, delighted to hear the plans that your organization had for including the limited English proficient population. And you have shown a commitment to this population as well as the deaf and hard of hearing. So I would love for you to describe what your organization does and what are the driving values, your mission and vision.
Of course. Well, thank you, Carol. I'm happy to share a bit more about the Immune Deficiency Foundation, or IDF. And we were founded in 1980, and we improve the diagnosis, treatment, and quality of life for every person affected by primary immunodeficiency, or PI. We foster a community that is connected, engaged, and empowered through advocacy, education, and research. We are considered the leading source of information if you're looking for answers to questions about PI. Whether you've been recently diagnosed, you've been living with PI for years, or you think you may have a PI, we are here to help. IDF offers programs designed to engage, connect, and empower families to live longer, stronger, and healthier lives. Our vision is a healthier day every day for every person with immune deficiency, and that's really a guiding force in everything that we do each and every day at IDF.
And I love the emphasis on every person. And let me tell you something. When we provided interpretation services for one of your conferences, as I was actually preparing and then interpreting for one of your experts, I realized that my father had one of those illnesses. And your organization was super responsive. And now my father lives in Colombia, so this is outside of the United States, etc. But I was able to get responses from your organization and from some of your experts on how to tackle that. So thank you. And this is just to show that you really mean every person.
Mm-hmm. Yeah, and thank you for that example, Carol. I think that's a great example of just our mission in action. We are here to serve everyone, whether you are a patient, a caregiver, a friend, a medical provider. That's why our vision is so important. Like, we want to be inclusive of every person that's impacted by immune deficiency. So thank you for sharing
Yeah.
your story.
And that every person includes the limited English proficient individuals. So, can you tell us a little bit more about the specific policies and frameworks your organization has implemented to ensure language access for LEP or limited English proficient individuals?
Yeah, sure. So until recently, our efforts to ensure language access were really program specific and often tactical in nature. You talked about how we came to you 4 years ago to help to have you translate some of our resources. That was very program specific. So we knew eventually that we needed to have a strategy to ensure our resources and programs were culturally competent but also accessible to all. But as a small nonprofit, translating materials was not necessarily in our budget year after year. So last year, in 2023, we started to lay out a 3-year strategic plan, which included objectives and milestones surrounding access and accessibility, including ensuring that our most used resources are representative of diverse communities and that our web content meets web content accessibility guidelines and is also ADA compliant. So, this strategic plan is really our first organizational wide effort to ensure that we are meeting the language needs of our community. And for our team, all of the staff that work for IDF, it's more than just accessibility. Our focus is really about inclusion. We see diversity in communication as an additional measure to our outreach efforts to the undiagnosed community.
Yes, and I really want to underscore your commitment to inclusion. As we say at Equal Access Language Services, there is no inclusion unless there is equal access. And your dedication also to cultural competence. But I also want to underscore the idea that at some point your organization realized, okay, we need a budget line to plan for language access. Because let me tell you, often we find situations where the potential client didn't think about interpretation and they expect us to basically provide it for free, or they get unqualified
Mm-hmm.
persons to do the interpretation. So, can you tell us a little bit about that strategic process when you say, you know what, we need to plan to have money for this?
Mm-hmm. Mm-hmm. So I think what really helped us to keep that front of mind is going back to that programmatic piece, is that you helped us translate many of our resources for a program that we had developed called Skid Compass into, I think at the time, by the time it was done, it was 12 languages. And that was part of our grant requirement, was that we needed to provide culturally competent and appropriate and accessible language resources. So it was built into our grant. And I think through that experience of working via a grant and being able to provide these services, we realized how important it was, and realized that, oh, we have to keep, if we want to offer something like this, we need to budget for it. So then when we worked through our strategic plan opportunity by outlining our goals of access and accessibility and ensuring our resources are representative and accessible to all, that reminded us to, oh, we have to keep a budget line item here for this as well. If this is a strategic plan and a strategic priority, it has to be included as part of our plans, and budgeting is part of that.
Yes, I feel like doing a happy dance, right? Hearing like, yes, we actually are planning for 12 different languages,
Mm-hmm.
website. And I also wouldn't mind if you mentioned what other things besides translation and interpretation, what kinds of services do you provide for patients and their families that are multilingual resources?
Mm-hmm. Yeah, so all of our educational content, we offer the opportunity to be translated or live interpreted. We do also have resources that are print, but also digital or downloadable, that are offered in other languages as well. So if you are looking for something like a printout to take to your doctor's office or a resource to take to your child's school, we have those available in English and in Spanish. We also have an individual on our staff who speaks Spanish. So if we do get someone who calls or who emails us looking for information or support, we do have an actual on staff person who can communicate with them in Spanish language.
And you also, if I remember correctly, you also offer closed captioning in some of
Hmm.
your programs, and
Hmm.
included also persons with that are deaf and hard of hearing in your
Hmm.
most recent conference.
Yeah, so all of our programming offers closed captioning, live and on the recordings. And then your team was wonderful, Carol, and helped us
Thank
offer
you.
um, ASL interpretation at our large in person conference that had just about 900 people this past summer. So we offer a lot. We also ensure that if you need an accommodation, we want to know about it. So on all of our registration forms, there's options that if you need specific interpretation, we try to accommodate that to the best of our ability, especially if it's something that's in person.
Yes, and I want to invite people that either have a family member that doesn't speak English or that will require interpretation services to really respond to these surveys or the materials that you send out, because it is very sad to see such a big investment in inclusion and then people don't know about this or don't participate or answer, oh, yes, I need a Spanish interpreter or another language interpreter, and then you can provide that. So there is the intention and the willingness, but then people don't take advantage of that. So
Hmm.
we really would love to say to everybody, take advantage of this,
Hmm.
attend these conferences because they're
Hmm.
there for you. And organizations like IDF are making sure that you are included and that you have language access. So
Hmm.
now, when we talk about training, we understand that there is a big need for training staff on language access specifically, right? Um, and that's going to come about with the new regulations, the 1557 of the Affordable Care Act. So we're happy to hear that training is going to be a big part of it. So let me ask you, what kind of training do your staff members receive to effectively communicate with LEP patients? How often is that training updated? And, just tell us a little bit about the training.
Yeah, of course. So, given our strategic objectives and our milestones for this year, we've spent a lot of time raising awareness amongst our staff about the importance of offering accommodations to those who are limited English proficient and or hard of hearing. Um, there are some of us on staff who work more closely with our community than others. So the need to keep that, the need for accommodations is more important for some versus others. Like we have individuals who work in our accounting department who um, know that we offer these services to individuals, but the individuals who work in my department, our education and community services, need to know that, oh, for all of our registrations, we need to make sure that we're providing or requesting accommodations. So there's some people where it's maybe a little more important than others. However, one of our core values at IDF is inclusion. So we actually had the Equal Access Language Services team provide a training to our staff back in 2023 on the importance of language access, and it was really well received by our team. I don't think many people, going back to the example of the folks who work in accounting or the folks who work in IT, they don't always think like, oh, language access is important. Like if you don't speak English, that's a huge barrier to understanding and navigating the healthcare system. So it's just raising that great awareness for all members of our team. So we were really grateful to be able to offer that to the whole IDF staff just a little over a year ago.
Yes, and we are happy to talk about language access and why
Mhm.
it's important endlessly. So,
Yeah.
anytime we will be happy to do
Mhm.
a 1 hour training for staff.
Mhm.
I think that's the kind of thing, an activity that will actually slowly but surely
Mhm.
change an organization's culture.
Mhm.
You mentioned cultural competence. How does the organization ensure that cultural competence is integrated into the care provided to LEP patients?
Mhm. Yeah. So we are certainly not experts when it comes to complete cultural competence, but I like to think that we are doing the work internally to ensure that the work that we do reaches those who are undiagnosed but also underserved. We've really just started on this journey towards cultural competence, just learning and listening and just seeing what options are out there. So I might classify us as an organization that is culturally responsive and certainly has a lens or a forward facing focus to do better.
Yes, and I am aware that the term cultural competence is very sticky because people tend to think that by competency we mean being proficient in another culture, and
Hmm.
we acknowledge that that is impossible.
Right.
So, with that caveat, we continue to use it, but we understand that there are many different ways of calling
Hmm.
it, cultural awareness, cultural humility. But just for consistency, we have stuck with cultural competency, understanding that it doesn't mean you are fully proficient. There is never a proficiency in another culture, not even a person to person, right?
Mm-mm.
Um, so tell us a little bit more about the strategies that you use to reach out to LEP patients, LEP communities. How do you ensure that they are aware of the services that are offered to them?
Sure. So I have a couple of different examples to share. So back in 2022, the Immune Deficiency Foundation sponsored a white paper challenge to address issues related to primary immunodeficiency and health equity. This included disparities in diagnosis and treatment, expanding awareness of these rare disorders in communities of color, and so on. And we actually had three awardees that we chose, and they received some modest funding to support their efforts to address some longstanding equity issues in the PI community. One of those awardees was Dr. Vivian Hernandez Trujillo, who's the founder of Allergy and Immunology Care Center of South Florida. She's also helped the IDF team produce some Spanish language videos on COVID 19 in those early days of the pandemic. So, her aim with her white paper challenge was to increase awareness of primary immunodeficiency in the Latinx communities. By identifying community needs, developing some Spanish language resources to meet those needs, and distributing them at festivals, community events in South Florida. So it's through efforts like this and supporting and partnering with other leaders who have more recognition in these communities that IDF hopes to expand our reach. But some other ways that we ensure that we are able to engage persons with limited English proficiency or those who are deaf or hard of hearing is to simply include the need for accommodation in our registration forms for events. So A PI diagnosis, for those who don't know, is not isolated to just one group or one group of individuals. So anyone, regardless of your race or ethnicity, can be diagnosed either at birth or later in life. And research shows that a high frequency of hearing loss is found in patients with certain types of PI, known as antibody deficiencies. So just knowing that who can be impacted by one of these rare conditions and how one of these diagnoses can impact how you access information is an important component to ensuring we have services readily available.
Lovely. I would love to get a hold of some of those papers and maybe explore them and publish it in our website or something. So I would love to have the paper you referred to. And yes, thank you
Yeah.
for
I'll gladly
understanding
share
that.
with you.
Awesome. Yes. And yes, I mean, there is a big effort on your part to try to get people into the conferences to make sure that they receive this information, at least in Spanish, which I believe is a population that needs this information, or by volume, I guess they need this information, certainly. So, how do you usually assess the effectiveness once you have offered language access services? How do you assess the effectiveness of the service? Do you collect feedback from the LEP patients regarding their experiences? How do you go about that?
So, with all of our community facing programming, we survey registrants and attendees on their experience. This includes how they found the content level and the accessibility of all of our programming. Was the presenter easy to understand? There's also fields to include any other information or feedback that you have or that you want our team to know about. So while it's not maybe specifically or explicitly specific to those who are LEP or deaf of hard of hearing, but we hope that people will put their experiences down into this feedback form. So that's something we're hoping to maybe better implement at future events. We've only just now in 2024 started to our return to in-person events and education. So that's certainly a goal for us moving forward, is to have be able to drill down even more specifically to those who access some of our accommodations.
Yes, and we also like to provide a survey to assess the quality of the interpreter. I think the more our clients know what to expect from an interpreter, the better and the more demanding they will become, and the better the service will become. So
Right.
we're also collecting information on that. But it is super important that you partner with language services, and this is for everybody, right? Just as the IDF has done, that you partnered with language services that hire interpreters that are trained, that follow a code of ethics, and that you understand, that get familiar with what is that profession about, what standards they follow, so that you can demand them. In terms of the allocation of resources, how are resources allocated to support language access services within your organization? And you mentioned there was a dedicated budget, right?
Exactly. So we had experience through a grant program that we operated where funding was specifically required and then earmarked for translation and interpretation services. But now that we are choosing to focus some of our strategic priorities on access and accessibility, we need to keep in mind the need to earmark funding for translation and interpretation efforts. So this is something that we include in all of our yearly plans, both from a programmatic side and a budgeting side. So when we sit down and figure out, okay, in 2025, we are offering X, Y, and Z programs, we also need to figure out, based on this number of programs, we need to set aside a certain amount of funding to allow for interpretation or translation of materials, depending on whatever project or event or program that we're offering. So it's now something that we all try to keep at the forefront of our minds when we're doing our plans.
So if I understand correctly, it's not only through grants, but also part of your strategic planning every year or every 3 years. Okay.
Yeah, the way we operate, we have like core programming that we offer, as well as a bunch of other different initiatives, whether that's a medical outreach initiative or a life stages initiative or our teen youth programming initiative. So we have different buckets and different avenues of programming that we offer, and we want to make sure that certain things are allocated specifically for each program.
Tell me a little bit more about your experience with grants. I think that, I have come across a few grants and partnered with organizations that are applying to such grants, and there is a portion for language access. And I'm, of course, delighted to see that. What was your experience like when you had the opportunity to submit a grant?
From my perspective, it was very positive, and the way that the grant was written out was very clear that access and accessibility and cultural competence and creating resources that would be utilized by anyone was a clear objective of the grant. So it made our ability to create a program and ensure that we had translation efforts included. It made it almost easier because it was spelled out for us already. And the program in question is called Skid Compass, and it was developed in response to severe combined immunodeficiency being added to the newborn screening panel across the U.S. So every baby who is born in a major hospital gets a blood spot taken, and they are tested for a long list of potential conditions and disorders, and SCID is one of them. So anybody could be picked up through newborn screening for SCID, no matter who you are, where you live, what language you speak in the US. So it was important for us to make sure that if parents get a call from a doctor that their newborn itty bitty baby is suspected to have this life-threatening condition, we wanted to make sure that resources were available to them in a language that they understood, because that can be a very scary thing, especially as a new parent. So it was easier, I suppose, for us because it was really spelled out in the grant exactly what we needed to do, and knowing that the focus was on something like SCID that impacts, or on SCID through newborn screening, which could impact everyone and anyone. So I can't really speak to signing on to a grant where one of the objectives of access for all isn't so clearly spelled out.
And remind us what does SCID spell out?
Yes, SCID stands for Severe Combined Immunodeficiency, and it is essentially when babies are born without an immune system and cannot fight off even the simplest of infections. The treatment for a infant with SCID is a bone marrow transplant, or depending on your type of SCID, you might be eligible for something called gene therapy. But it is an ultra rare condition that can be life-threatening, and it's very important to be diagnosed early and treated very quickly. So that's why it is now included in the newborn screening panel, so that way infants can get identified very, very quickly after birth.
And also remind our audience what you mean by PI.
PI is primary immunodeficiency, and it is a group of nearly 500 disorders where a component of your immune system is missing or does not work properly. So individuals with primary immunodeficiencies have a really hard time fighting off infections. That might mean that they get recurrent sinus infections, GI bugs, you might have pneumonia several times a year. So it's beyond just someone who has a common cold. This is an individual who is getting sick really, really regularly, and it's keeping them out of school, keeping them from work. And it can be really challenging to get a diagnosis because you're having a hard time fighting off infections, but these infections show up in a lot of different ways. So you might have a sinus infection and then a GI bug, and then you might have pneumonia, and then you might have insert whatever continuing diagnosis on and on and on. So a doctor will treat whatever the infection is that they see and not necessarily put together the trend that, oh, like you've had a lot of these varying infections. It might be a component of your immune system that doesn't work.
So no, it's not only scary to
Mm-hmm.
get such diagnosis, but it doesn't discriminate, right? The illness is not going to go like, are you limited English or you actually speak English fluently, right? Unlike humans who discriminate,
Mm-hmm.
illnesses don't. And that's why it's so important that you, as an organization, are keeping in mind that anybody can get one of these
Mm-hmm.
immunodeficiency
Yes.
illnesses. And it's important for everybody to remember that in the field of healthcare,
Mm-hmm.
illnesses don't discriminate, right? And we should all be prepared for language access plans if we're in the healthcare field
Mm-hmm.
specifically, right?
Exactly.
Thank you so much for giving us those examples.
Mm-hmm.
Now, when it comes to technology, do you have any solutions, any technological solutions that you have implemented to facilitate language access for limited English proficient individuals?
Yes. So our website, primaryimmune.org, has many accessibility features embedded into its design. I am not an IT or communications professional, so I could not speak to the back end of what that looks like. But we do have a lot of features within the design that help those who are limited English proficient or require other accessibility features. We also, for our in-person conference. I know I spoke about it a bit earlier. We had an in-person conference earlier this summer, but we had an app that was linked to all of the sessions that we were providing. And that was a great opportunity to be able to guide and direct individuals who were on site and maybe needed additional assistance. But also, many of our virtual educational sessions have closed captioning embedded in real time, but also on the recording. So we utilize Zoom for all of our live webinars, and then all of those get posted on to YouTube, where the recording, and then we also include a PDF of the slides as well.
Yes,
I'm
so
sure we do
important.
other things, but I can't
No,
I
but
can't think of them right now.
I think it's important to remind people that, for example, to have that accessibility
Mhm.
on the website, you have to, order the translation of that,
Mhm.
or at
Mhm.
least, the or several components of the website. And
Mhm.
we are hoping that at some point, especially if you have more direct interaction with limited English proficient persons,
Mhm.
we can get you the 24/7 services that our company has. So, just for our listeners, Equal Access Language Services specializes on offering 24/7 services, especially to smaller organizations that want to have a language access 24/7, right? So you just make a phone call, you get access to about 10,000 different interpreters in different languages, and then the interpreter is live, right? So that's one of the services that we provide. We want to eliminate all excuses for any organization that cannot afford a full-time interpreter. We have solutions for that. So those things are evolving, and now it's becoming a lot easier to have language access with qualified individuals 24/7. You don't have to be like a hospital or somebody with a huge budget to do that. So this is for our listeners to keep in mind. um, do you collaborate with community organizations or advocacy groups or government agencies to enhance language access services for the LEB populations?
Yeah, so I wouldn't say that we partner with these groups, community organizations, advocacy groups, or government agencies specifically with the goal of enhancing language access. However, we do work really closely with these groups in other capacities, such as advancing policy efforts related to access and accessibility for treatment options, raising the index of suspicion for diagnosing PI, or offering educational opportunities to our community. And I think it's through those partnerships that we're then able to ensure language access for anyone participating in those programming, whether that's through our website, or other language access tools through collaboration with you all at Equal Access Language Services.
Yay. Yes, and we're happy to collaborate with you. We love it. How does your organization ensure compliance with federal and state regulations regarding language access? For example, Section 1557 of the ACA and Title 6 of the Civil Rights Act of 1964.
Yeah, so quite frankly, we work very closely with you all at Equal Access Language Services to ensure that we're compliant. Again, we are a small nonprofit and we are still learning and trying to do the work. And we make every effort to ensure that our programming is accessible to all. And that includes including language services for events, translation for materials, but we also have a really robust volunteer program. And we ask many of our volunteers, like, do you speak another language? Are you proficient in another language? If we have somebody reach out to us looking for connection, looking for support that speaks another language, or can we call on you to be that connection to them, to bring them into the fold? So thank you to Carol, you and your team for helping us meet this compliance.
No, I think it's super important that regardless of the size of the organization, people are aware that's all about preventing discrimination. And I think you do a great job with that. I just participated on a live stream event that talks precisely about language access. And I really want to make the point that it's all about preventing discrimination, right? We often worry too much about, okay, this is the law here and the law there, and that's great. I'm not discouraging people from knowing the law, but even beyond the law, the basics is just don't discriminate against the people that don't speak English, right? And I think your organization does a great job doing that, and we're happy to help. So let's talk a little bit about awareness and education. How do you educate or conduct outreach to the LEB patients, the deaf and hard of hearing, and their families? How do you communicate their rights to language access services and the availability of these services within your organization?
Yeah, so I think this ties back perfectly to kind of how we started this discussion, and I shared about our recent efforts to lay out our first ever strategic plan. And it's really our first organization wide effort to ensure that we are meeting the needs, the language needs of our community. So, as a small organization, a healthcare nonprofit, we are doing our part to ensure that the program we provide is accessible and inclusive, and we're making an effort to invest the time and the dollars to do so. I think for many in our community, the biggest struggle, is receiving that PI diagnosis. I think our own survey data shows that for some people, it can take over a decade to get diagnosed after years and years of those recurrent illnesses that we were talking about. So, the work we do day to day for patients, caregivers, and medical professionals is to really raise the index of suspicion to hopefully get people diagnosed sooner and increase their quality of life. But for many people, receiving a rare disease diagnosis can be really scary and really confusing. Add in a language barrier, and that is an additional layer that can make people feel even more lost and isolated. If you don't have a medical degree, walking into a doctor's office can be really scary no matter what your language is. And then adding in that barrier makes it even more challenging. So, at the Immune Deficiency Foundation, we've made a commitment and an investment in ensuring that our resources are written in as close to plain language as possible for a rare medical condition, and are also available in languages beyond English, because we know we're not going to reach every single person overnight, but we are building a really robust catalog of content and programming that is accessible and available for people for when they do find us. And the team at Equal Access Language Services is really helping us to achieve that and meet that goal.
Alissa, you mentioned something that I'm glad you did, which is plain language. And I think this is super important because even if you have an interpreter, if you are not, I mean, we are not magicians, right? If you speak in a very convoluted English, is going to come across convoluted. So the effort to communicate in plain language. It's super important in healthcare and in the legal field and education, everywhere. We're better off with plain language. And the
Mm-hmm.
other thing that I think about when you are talking about these diseases is how we owe it to the people that are limited English to really provide language access because, and I say this all the time, not only have they gone through so many different instances where they have been oppressed or where they have experienced violence in their countries, and perhaps that was even the reason they came here. So if you think about the person that needs language access, oftentimes is a person that has endured other forms of discrimination or forms of violence or oppression, right? The person fleeing violence, poverty, then coming here through the coyote, for example, and then arriving to the United States and facing poverty again. And then the worst thing that can happen when you only have your body as your major asset is you get sick or you have a child that's sick, right? So imagine being in that situation after going through all of these other situations and then coming to a diagnosis that's so terrible and not even understanding what the diagnosis is all about. I
Mm-hmm.
mean, I really want people to think about how we compound things by not offering language access and how important it is.
Mm-hmm.
Alissa, do you have any questions for us? Is there anything you would like to add or ask from us?
I don't think I have anything to add or ask. I think I just want to thank you, Carol. You and your team have been really great partners as we have kind of explored and found the need and the importance of this work. And as we continue to move forward to hopefully make access to our information and our resources available to all. It has really been such a great honor to work with you all. You're wonderful to partner with, and we are so grateful when we send an email and you answer the call. And I just thank you for giving me the opportunity to join this podcast and share a little bit about the Immune Deficiency Foundation and primary immunodeficiencies to just raise awareness about them. They are rare conditions. And if you're out there suffering from recurrent infections, it might be a PI, and you don't have to suffer, and you're not alone. So we have great resources for you if you think that you may be living with an undiagnosed PI.
They have many resources in multiple languages. And thank you, Alissa, as well. You are one example of how an organization of smaller size can actually provide full services to everybody. So there is no excuse, people. uh, so thank you so much. And with this, we end our podcast today.
Thank you.
And that wraps up another enlightening episode of Language Access Matters. We hope you have enjoyed our discussion on the profound impact language access has across various sectors of society. Let's remember that language access is not just an isolated topic. It intertwines with various fields, impacting lives and businesses in profound ways. As we continue this journey together into becoming a more inclusive society where we ensure equal access to services to those who don't speak the dominant language, we want to assure you that our company, Equal Access Language Services, through its podcast Language Access Matters, will be with you every step of the way. We are committed to bringing you thought-provoking conversations, expert opinions, and stories from the field and beyond. To dive deep into the subject matter and engage with leading experts in the field, we will release a new episode of Language Access Matters once a month. By featuring expert practitioners and individuals with diverse experiences, we aim to broaden the scope of our discussions and present a comprehensive view of the importance of language access. We encourage you to stay connected with us through our website, www.equalaccesslanguageservices.com, and our social media platforms. You can join the conversation, ask questions, and share your own stories and experiences. If you want to be part of our podcast, email us to podcast@equalaccesslanguageservices.com. Remember, language access matters to each and every one of us. By understanding its significance and actively working towards its advancement, we can create a more inclusive and equitable society. Thank you for being a part of the Language Access Matters community. We appreciate your support and look forward to sharing more knowledge, inspiration, and empowerment with you in our future episodes.